Okay, good afternoon. Welcome to the Older Adults Behavioral Health Resources Lunch and Learn. My name is Sharon Diaz, and I am the Associate Director over the Adults and Aging programs for CFPIC. These Lunch and Learn sessions are brought to you with the support of CWDA and hopes to be able to bring a new topic to you each month on information that will be useful to you and your counties in conducting business specifically and around many of the CalAIM issues. So today we have with us Gretchen Schroeder and Heather Meow, who is Chapman Consultants and have worked in depth with the Department of Aging on bringing these tools and resources to you. So at this point, I'm going to go ahead and pass it over to Gretchen to continue introductions. I know we only have a short amount of time today, so I want to get right to it.
Great. Thank you, Sharon. Good to see everybody. Glad you're here. Looking forward to our conversation today, and feel free to ask questions throughout the presentation. Want to make this a conversation with all of you. So our agenda today is packed. Of course, we want to give you as much information as possible. We're going to talk about older adult behavioral health, kind of get an overview of what we know at this point in time. We'll also do an overview of Prop 1 and the Behavioral Health Services Act. And then we're going to jump into the meat of the presentation, going over the Department of Aging's Prop 1 toolkits for each county. And that will be a really exciting part of our meeting today. And then we'll share some resources with you. So with that, I'm going to invite Renita Polk to jump in and introduce our guest speaker.
Great. Thank you, Gretchen. Good afternoon, everyone. My name is Renita Polk. I'm with the County Welfare Directors Association, or CWDA. And so we work with CFPIC just kind of to help think through topics for these lunch and learn webinars. And so today I'm very excited to introduce Sarah Steenhausen. Sarah is the Deputy Director over the Division of Policy, Research, and Equity. Had to think through the acronym for a second. At the California Department of Aging. I'm really excited to hear Sarah talk about what the Department of Aging is doing. And I know firsthand what a great innovator and leader she is, because she used to be my boss, because I previously worked at the Department of Aging. So thank you, Sarah, for being here, and I will pass it to you.
Great. Well, Renita, it's amazing to see you. And we have forgiven CWDA for recruiting you, but no, we're very excited for you and the role you play, and I'm really happy to have this opportunity to first just provide a broad overview of older adult behavioral health, and so pleased to be able then to talk with Chapman Consulting and have them share the toolkit. So I'm just going to define at a high level what the need is, the problem, the opportunities, and some of the progress. Next slide, please. So I want to talk about, this is not the real picture of a woman, but this is a true story of a woman that I know in Santa Clara who, she had some behavioral health issues, more on the mild side, some anxiety, depression, but she had been employed and she was in her early 60s, and she was living with her parents in their trailer, and or more like their mobile home park. And when they passed away, they had promised her that she could stay in their home. But she became very isolated and more anxious, and really did not know how to pursue support and what that would look like. She ended up losing her job, and then also losing her home. And long story short, this led to tremendous anxiety, depression, isolation. She tried committing suicide 2 times and was not, identified by anybody in the service delivery system for any kind of follow-up. They did not know where to discharge her to, so they put her in a SNF. There were no services provided in terms of her ongoing behavioral health needs. And then eventually she just got discharged into an assisted living setting, and that didn't work. But long story short, she's doing okay today, but she still does not have, I think, the services and supports that she needs to address her ongoing isolation and loneliness. That really, I think, led to a lot of the problems that she faced. So I think it illustrates that there's a need to call out older adult behavioral health and the need to address across the continuum the services that they need in this space. Next slide. So first, the issue of unmet need. There are several figures out there that point to the problem of older adult behavioral health, but it's estimated that approximately 3/4 of older adults have an undiagnosed behavioral health need that has not been addressed. Next slide. A lot of the issues, that stem from this problem are stigma, concern about, what it means to seek services and supports, and also, feeling like, their own internalized stigma for what that says about them and their life if they have to admit that they need to get services and supports. Next slide. Among older adults, they account for about 1 in 5 of all suicides, unfortunately, across the state. And if you look at the next slide, you can see that people over aged 85 have the highest rates of suicide in our state. And unfortunately, too, this has really plagued older men. Older men have a 10 times higher rate of suicide than older women. So clearly, we know there's a problem, and probably because of a variety of factors, men are not getting the services that they need, probably somewhat stigma, somewhat isolation, and not knowing where to go for help. Next slide. Social isolation is really a big issue that we're trying to call a lot of attention to. Older adults have become increasingly socially isolated. And if you go to the next slide, we did a recent survey in 2023 of 17,000 Californians. 40% reported that feeling lonely or isolated was a problem. 45% reported feeling depressed, and nearly half of those surveyed are dealing with recent grief or loss. And this kind of reflects what we heard about my friend Karen, who was lonely, isolated, depressed, and dealing with recent grief and loss. Next slide. We were really fortunate to work with Insure the Uninsured Project on a recent survey that they commissioned of local government, nonprofits, community organizations, and health plans, where we had about 225 responses to really see what their understanding was and what they identified as the issues associated with older adult behavioral health. The number one challenge noted was social isolation and loneliness. And second to that, really also another high level of need was the lack of behavioral health services, focusing particularly on the needs of older adults. And more than half of those surveyed thought it was really important to think about how we can integrate behavioral health services in the settings where other older adults gather, so that we make it more seamless of a delivery for them. Next slide. I think it's really also important to highlight the equity considerations for older adult behavioral health. Next slide. We commissioned the first statewide study of LGBTQIA older adults in California, and we had a response. Approximately 4,200 people responded from across the state. Nearly half of those have experienced a traumatic event in their lifetime. 1 in 4 have symptoms consistent with post-traumatic stress disorder, and 1 in 10 have reported serious thoughts of suicide in the past year. Next slide. We also were able to convene a series of listening sessions in 2023 with older adults, caregivers, and community providers to really hear on the ground from the community about what they saw as the issues impacting older adult behavioral health. And we heard time and time again, social isolation and the stigma, as well as workforce challenges and trying to find the right providers that are culturally appropriate to meet the needs of our very diverse aging population with the appropriate training to understand issues specific to older adults. The importance also of really utilizing those trusted community partners. We heard a lot that older adults don't necessarily want to go to a therapist or a medical setting to receive behavioral health services. What is more important to them is to use those trusted sources of information. And it's similar to what we heard in our ITUP survey, which is it really would make sense to deliver services where people are already getting their services that they need in the community. And then finally, access. I'm sure that's no surprise to anyone, is just having a dearth of available services to meet this need. Next slide. So in order to address these needs, I know these are a lot of the same themes, across the lifespan of how we address these issues. Really focus on building resilient communities and how older adults can be empowered to address their own needs, fighting the stigma, and developing tailored messaging that's really culturally responsive to the different communities. Encouraging the recognition of need so that older adults like Karen don't have to will be able to understand and recognize when they need support and be able to speak up on behalf of their need. And then finally, and so important, is figuring out how we can increase social support and social connectedness among our older adults, particularly those who are living alone without support, like my friend Karen. Next slide. So we were really felt very hopeful with the passage of the Behavioral Health Services Act. We know that since the Mental Health Services Act was implemented in 2004, there wasn't a lot of I would say enough opportunity to really focus on this issue of older adult behavioral health. So really, we wanted to use this opportunity to refresh the conversation and to importantly engage our local networks and how they can work at the county level to advocate for the needs of older adult in the behavioral health space. So we were really fortunate to get support from West Health to work with our colleagues at Chapman Consulting to develop a toolkit for our local partners, which actually turned into 58 toolkits, as Gretchen and Heather will speak to. And we are just so grateful for this partnership. They did an amazing job pulling together this resource. And I'm going to hand it over to Gretchen, who will talk about it along with Heather.
Great. Thank you, Sarah. And that was a really good overview of some of the older adult behavioral health needs. Now we're going to jump into just kind of looking at the Behavioral Health Services Act and Prop 1 and understanding where there may be opportunities for all of us to get more involved to help address some of those older adult needs that Sarah raised. So quickly, Prop 1, we passed this as voters in California in March of 2024. There are two components to Prop 1, and that's important to really understand how the money's working and what it's going towards. One component is Behavioral Health Services Act, and that's really trying to modernize and expand the Mental Health Services Act, which Sarah mentioned began in 2004. The other component is the Behavioral Health Infrastructure Bond Act, which is really putting money towards housing. It can be for treatment beds, supportive housing, community sites, but really trying to generate more housing units and beds in the state. This is really intended to be a sweeping change across California. We know it's going to take some time for all of this to begin working, but the intent is there to really shift how we're doing things. The Behavioral Health Services Act is really looking at moving some dollars around from the Mental Health Services Act budget. And so we're having a huge shift in how county behavioral health departments are thinking about these funds and what services they can support. Some important pieces here is that it is building off of MHSA, the Mental Health Services Act, the Millionaire's Tax, but it's also broadening what it's covering. So now it also includes substance use disorder treatment services. So that's going to be important as we look at what are the needs of older adults here. It's also requiring counties to develop a county integrated plan. It's a 3-year plan, and they're required to do annual updates. And key for all of us here today is that counties are now required to conduct ongoing community engagement across all stages of planning. So looking at how do we get involved, how do we engage, how do we advocate for our populations. There's also a big change in funding structure. And so if you talk to county behavioral health directors, you'll hear them saying we're being asked to do more with fewer dollars, which is probably true. It's going to be a huge shift for all of us in how we engage with each other. But the state has laid out some targets here. They would like to have the housing intervention programs be 30% of the funding. So really looking at how that can be utilized. What are the housing that can be designed for older adults? So thinking through that opportunity there. The state is also saying that 35% of the county funding allocation should be put towards full service partnership programs. So if we think about the older adults we work with and who may be at risk for institutionalization, this could also be an opportunity to get more involved in the full service partnership. And last but not least is behavioral health services and supports. This does include early intervention programs, so that's really important. The state has allocated 51% of the early intervention programs to children and youth, but that still leaves 49% for adults of all ages. So a great opportunity here to think about what we can advocate for, what programs could be helpful to the older adults that we work with. So counties can ask to reallocate the funding percentages here. They can also ask to have an exemption to some of the requirements, and that's all going to be part of the process. And so as counties start to engage in all of this, you'll start to see some changes being made. So some important dates for all of us to be aware of. In January of this year, counties were encouraged to start doing stakeholder engagement, and some counties did a great job, launched really early. They may already have had some processes in place to do that. Other counties are still in the process of launching some type of stakeholder engagement. So it's going to be really important for all of us to look at what our counties are doing and how we can get involved. And we'll cover that in the toolkits. For March of next year, the counties are required to draft a county plan, and they must have a 30-day public review of their draft integrated plan. At the end of June of 2026, they must submit their final county plan to the Department of Healthcare Services, and then they must do annual updates of those plans. And so as we're sitting here today at the end of August of 25, we want to make sure that we're engaging with our county behavioral health departments on these dollars, how they're going to be used, and making sure that we're helping to advocate for older adults and their behavioral health needs. This all leads to lots of opportunities for all of us. With the service expansion, there's new opportunities to really engage our older adults in substance use disorder services, looking at what's going to become available and more available to folks. And then looking at the evidence-based and community-defined practices out there, what housing could be beneficial to our older adult populations, and of course, full service partnerships. When I think about all of this change and how this can really be a benefit to older adults, we need to have folks advocate for older adults and really start to engage with the county behavioral health departments to make sure that they understand, number one, what are the needs of the older adults in our county. And we did some key informative interviews across the state earlier this year. One of the things that we heard consistently from providers is they didn't think their counties fully understood the demographics of the older adult population as well as what their behavioral health needs are. And so making sure that as we engage, we want to have that data. We may want to have some stories of older adults to really support why it's important to invest in services targeted to them. We also want to make sure that we have flexibility to innovate. As we've heard, this is a huge shift for behavioral health departments. So thinking about how we engage with them and help them really find programs that can support older adults. As we mentioned on an earlier slide, 90% of the allocation of BHSA is going out to the counties, but the state is also holding about 10% of the funds for state level investments. The three big buckets that they're looking at for these investments will be the workforce initiatives, and they've given some dollars to the Department of Healthcare Access and Information, or HCI, and they're starting to launch some initiatives around BHSA. We also know the Department of Public Health is going to be tasked with doing some population-based prevention, and they've actually put out I think a stage 1 paper for all of us to review and give feedback on. So you can look at that and see if that matches up with what you think is important for older adult prevention services. And then last but not least, we have some outcome measures the Department of Healthcare Services is developing to help us see how these dollars are being spent and how it's all impacting folks across the state. So that's 10% of the total funding will go to these 3 buckets. Now, as we've talked about this, very high level overview, a lot of information. We have a lot of links in here and you will get the presentation. It will be posted on CFPIC's website. We also wanted to take you down to the toolkits, which is going to be a lot of great information about what's happening in your county and the opportunities available for you to get involved and really engage with your county behavioral health department. So with that, I'm going to turn it over to Heather, who was the one who really spearheaded developing these toolkits along with Sarah and her team.
Great. Thank you, Gretchen. Hi, everyone. For this section of the webinar, I will be walking through the Prop 1 toolkit. As Gretchen mentioned, these toolkits were designed to help providers, advocates, and community partners understand what Prop 1 means, how funding flows from it, and how to get involved in shaping local plans. So to get started, I wanted to provide just a brief overview of the toolkit first, which is roughly broken up into 5 sections. It touches upon the growing behavioral health needs for older adults, underscoring why investing in older adult behavioral health is so important. It highlights the importance of stakeholder engagement and provides practical steps that stakeholders can take to engage with their local partners and local and statewide leadership. There are also sections that highlight early intervention programs that are focused on older adults. And lastly, the toolkit provides county-specific resources and contacts that includes point of contact for the BHSA at the local level, relevant stakeholder meetings, and important demographic profiles of older adults. Next slide. Great. So for the first section, it highlights the growing behavioral health needs for older adults. As we've seen from the statistics and stories shared previously, issues like social isolation, depression, grief, and lack of access to services can be widespread within this population. This section provides statistics as well as talking points that counties can use to make the case for investing in older adult behavioral health, and it underscores the importance of ensuring that older adults are prioritized in the local planning processes of the BHSA. Next slide. Section 2 focuses on stakeholder engagement. Under the BHSA, like Gretchen mentioned, counties are actually required to engage with local stakeholders when developing their integrated plans. So this includes people with lived experience, including older adults and caregivers, area agencies on aging, independent living centers, CBOs serving diverse communities, and of course, behavioral health providers, peers, and workforce representatives. Next slide. The toolkit also provides a stakeholder engagement checklist. So this is a very practical guide for how to plug into county processes with regards to the BHSA. It encourages education and advocacy, like reaching out to behavioral health and aging departments, as well as engaging with the County Board of Supervisors. It also stresses coalition building, including sharing stories. Oh, sorry. That was an Amber Alert. Apologies for that. Like I said, it includes stresses coalition building, sharing stories, joining advisory committees, and participating at local planning meetings to advocate for funding for older adult services. The checklist is actually really a roadmap for how stakeholders can move from awareness to action in their own communities and specific counties. Next slide. The toolkit also includes appendices. So one appendices is focused on early intervention programs. So under Proposition 1, counties are actually required to allocate a specific percentage of their funding to establish these types of programs to prevent mental health and substance use challenges from becoming more severe. The toolkit highlights how these programs can be tailored to older adults, so things like outreach to seniors experiencing isolation, linkages to needed care, or grief and loss support groups. It also provides examples of programs specifically tailored for older adults, so these can be used as models that counties can look to as they design their own set of services and programs under this specific section of funding. Next section. So the fifth and final section brings it down to the local level. So here you'll find county-specific resources, including contact information for local behavioral health staff, board of supervisors, as well as relevant stakeholder meetings. These resources are really designed to help stakeholders know who to call and where to show up in order to participate in the BHSA planning process, and is why Sarah mentioned that there are actually 58 county toolkits. So one for each county of California. Next slide. The Department of Aging has also developed county demographic profiles of older adults that has been included in the toolkit. These profiles highlight the demographics, needs, and behavioral health trends for each county. They can be powerful tools for advocacy because they show the specific realities for older adults and can strengthen the case for targeted investments within the BHSA. And so here we've included a screenshot from the Alameda County demographic profile that is included in the Alameda County Toolkit. It includes, like I said, different statistics like age distribution within the county, as well as race and ethnicity percentages. Next slide. It also includes projected population shifts within the county, as well as different socio and economic statistics related to Alameda County and other counties. Like I said before, each county toolkit has the county demographic profile included in the toolkit, but for a statewide overview, you can also access each of the demographic profiles for all of the counties at CDA's Master Plan for Aging Data Dashboard webpage, which is also linked on this specific slide. Next slide. So the toolkits are now live and accessible, and I believe Peter had actually put in a link, and Gretchen just put in a link to CDA's website where you can navigate to the toolkit for your specific county. As I mentioned before, these toolkits were developed with you all in mind, providers, advocates, and community partners, and it is really the goal of the toolkit to help others or stakeholders understand the local planning and funding structures under Prop 1, identify where and how to engage in stakeholder processes within their specific county, and of course, strengthen partnerships with behavioral health and aging departments, all so that they can advocate for programs that address the needs of older adults in their community and county. Next slide. And so finally, we've also listed additional Proposition 1 and BHSA resources. So at the first two bullets, we've listed and linked the DHCS Behavioral Health Transformation webpage, as well as the Stakeholder Engagement webpage. So this is where you can find information on the BHSA, the Bond Act, and stakeholder engagement opportunities that include statewide public listening sessions, advisory committee meetings, and webinars. We've also included links to the BHSA County Policy Manual, and a link has also been included in the chat, where this is where you can find important information and resources for counties regarding the draft integrated plan. And lastly, we've included a link to the DHCS Proposition 1 fact sheet, which provides kind of a basic overview of Prop 1 and its key elements that is easily shareable across to different stakeholders. And so with that, I hope that was helped you get a better understanding of what the toolkit has to offer you. I will pass it back to Gretchen.
Great. Thank you, Heather. Great overview. And we really encourage everyone to check out the toolkits and look at their own counties and find out what's happening there. So at this point, we're going to open it up for questions. I'm actually going to take the slides down so that if we want to ask questions, we can look at each other, and please come off camera if you feel comfortable, and you can raise your hand, you can put it in the chat, whatever works best for you, but I will open it up. Has everyone been aware of the BHSA and what's been happening in your county around stakeholder engagement? Anyone been involved in those meetings yet? Okay, Melissa, I like seeing it. Okay, we're getting some thumbs up here. Anybody else? Anybody have any questions about the BHSA Prop 1, how it can be an opportunity for older adult providers or advocates?
I don't have
No
any
one else.
questions. I was just going to say, this is Melissa. Sorry, I don't have any other questions. I don't have questions, but I would encourage people to get involved locally because the funding, there's no additional funding with BHSA, right? So county behavioral health departments are having to figure out how to do things a little bit different and report things a little bit different to the state, and the resources that used to be provided to local community-based organizations or local mental health services are now being stretched and moved elsewhere. So I think it's important to understand what the statewide prevention efforts are going to be, as well as the local early intervention efforts as a result of this. And yes, I would say that older adults sort of get lumped into that adult mental health population. So anything that can be done to recognize the importance of evidence-based practices like pearls for older adults, I think is really important for us to advocate for. Thanks.
Thank you, Melissa. And MIC, you have your hand up as well.
Yeah, no, thank you for the presentation. I just wanted to say, looking at our county toolkit, and that's really helpful. But at least in Marin, where I'm based, I just feel like we don't really have a lot of information coming out of our behavioral health. So I'll try to maybe engage with some of these other stakeholders and see if they know of anything. But I work in adult protective services, and we have, and in-home services, and we have a huge need for behavioral health supports, and really have very little kind of things to offer to our clients. And it's really frustrating because these people are coming back with multiple reports because the situation is not being resolved, right? So thank you. That's helpful. I guess that's where I will personally start, but I just wanted to communicate. I feel like, I hope I'm not alone, but I don't feel like
You're not alone.
Yeah.
Counties are all over the map in terms of what they're doing at this point. Sarah, I'll let you jump in here.
Yeah, no, thank you, Em. I appreciate that very much. And I think in that instance, um, you know, working with the local area agency on aging in Marin and ensuring that maybe you all can work together or form, some sort of a partnership with other organizations, because it is required that the area agencies on aging are included as part of the stakeholder process. So I think really looking at the toolkit and what some of the potential evidence-based programs for early intervention that you can bring forward with your aging partners. And as Melissa Jacobs noted, Pearls is a great example of a very effective program that does fall in the early intervention space. So that's one example of how you all could bring forward a proposal to the behavioral health, whatever the entity is that's focusing on, at the county behavioral health department, on how to fund under the new Behavioral Health Services Act. They're going to have to be developing an integrated behavioral health funding plan, and it's going to be, released at the state level or to the state level sometime, I think, next spring initially. So I think getting to the table now and trying to put the input in. And the great thing is that the state is going to have to make everything transparent. So they're going to show what are the entities that put in proposals that didn't get funded and why. So it will be really good to be weighing in on the need in that space. So that's all I have to say on that.
Melissa, you had given a thumbs up about getting involved with your county. Can you speak a little bit more to what types of meetings or engagement the county is offering to providers around the BHSA?
Sure. So in Sacramento County, they've been doing several information sessions with different stakeholder groups across the county. They have presented at the Criminal Justice Cabinet to law enforcement and judges. They've presented to multiple culturally responsive providers at their cultural competence committee, and invited many others to that. I think they've presented at different advisory bodies and commissions. They've done community listening sessions, and they are utilizing Mentimeter actually to gather input from the community, identifying what they're doing well and where there are gaps. And so they're doing quite a bit of that in terms of their plan over the next couple of months. And they will come back to the community and provide a summary of what they've learned or what they've heard from the community as they prepare for developing their plan, which is due, which I think March, right? End of March.
In March, yeah.
Yeah. And I was going to ask a question because of Prop 1, Behavioral Health Services Act requires an advisory body specific to that. And so the Mental Health Services Act Steering Committee and the Mental Health Board and the Alcohol and Drug Advisory Board, those all have sunsetted in Sacramento. And so they are creating a new Behavioral Health Services Advisory Body that will be appointed by the Board of Supervisors. And so those applications and appointments are happening now.
That's great to know. And we're seeing that too. Some counties are just renaming their MHSA governing bodies. Some are having to stand up new committees. But I think it's really important to find out what's happening. And I also like that you raised that the county's been presenting to different existing committees or bodies too. So I think make sure that as you think about how your county is going to be presenting information, that you're trying to figure out where they are going, if they're going to all the different committees in your county, or if they're only presenting it through an MHSA or BHSA steering committee. Yeah, really great points. Anybody else had experience in their county with some of the BHSA information being presented at various committees or gatherings? All right, Valerie, I'm going to read your chat here. You're actually asking a question too. Are there changes to eligibility or diagnosis? Historically, if an older adult had symptoms of neurocognitive disorders, aka dementia, they were often denied behavioral health services. Are you trying to see if BHSA expands that definition?
Yeah, I think it's a gray area, and I work for CFPIC now, but I'm a former county employee, so
You know.
worked in county services for many years trying to get services for older adults. And with the age change with APS, that helped some access. But even if an older adult had symptoms, maybe not even a diagnosis of dementia, but if they had any kind of symptoms that looked like dementia, they were often screened out or we were told they couldn't serve. So I'm just wondering, with all these changes and the mention about access, is that also changed?
I can jump in on that, Gretchen. So, Valerie, that's such an important question. And I want to just clarify that what you're speaking to is the requirements under the Medicaid, the seriously mentally ill that get served out of the county mental health departments. So you're correct. There's a huge challenge because there's often an assumption that people who are older adults have dementia and that therefore then they're carved out of the seriously mentally ill population, but it's much more complicated than that. But I would say for this purpose, it's a different funding source. And there are absolutely, through the early intervention funding, can be services targeted towards those that have dementia or cognitive impairment. Many of them have depression or anxiety and can be served well to address those needs. So
That's great. And you also mentioned grief. So like grief can look like depression, and all those kinds of things. So thank you.
Thank you.
Okay. Pedro, do you want to come off mute and kind of share what you wrote in the chat? I think it's really important.
Oh, sure. Hi. Yeah, I'm Fedra. I'm a researcher at UCSF School of Medicine in the Department of Neurology. I work with the Memory and Aging Center, uh, and I'm also something called an Atlantic Fellow for Equity in Brain Health. I don't know if you guys have heard of our deal. Oh my gosh, look at those nods. How about that? Um, at the Global Brain Health Institute. So I'm hopping on here just on the off chance that anybody here might have guidance for someone like me who has developed a social health intervention that's intergenerational and has been shown to be effective among the older people who've been screened for loneliness here in San Francisco County. And we would love to figure out, are there ways of spreading the word about our work? And or yeah, I guess just any advice at all, because like I know how to measure whether something's working, but I'm really not too savvy about then what. Anyway, yeah.
Fedra, first of all, it'd be great to connect with you because we're very interested in how we can better address this issue of social isolation and loneliness. I would say though, for the county funds, they're not directed, this type of approach would be more of a population-based health management. And those funds for the Behavioral Health Services Act are being led through the California Department of Public Health. And so we're going to find out soon how CDPH is supporting the issues of of population-based prevention. It's going to be tough because, as has been said, the resources that go towards population-based prevention are less than they used to be. So but we agree that this is a huge need. And actually, there's that center that is led by, I don't know if you know Carla Parasinato at UCSF, because this sounds like a lot of what she's doing. And we're working with her team. So if you want to connect at some point, please reach out to me. I would love that.
And I did just drop in the chat a link to the CDPH kind of stage 1 guide they've put out for comment. So that might be of use too. Great, I love it. Connections being made right here. Wonderful.
Hi, this is Corey Allen. I loved your presentation. I just have to say how much I appreciate the conversation, especially as it relates to there's these pockets and such opportunity to bring them together. And just listening to your conversation, I'm hearing that coming to life. Would love it if there was a way to see Fedra, the work that you're doing in some way. I don't know if it's on a website or if it's something that's still in the works, but it just looks like something that could be really useful. And then there's one other thing I wanted to say. Oh, go ahead. Okay. And then the last thing I was going to say was at the beginning of listening to the questions, and I noticed the silence, it made me wonder if maybe some additional technical assistance can start coming out around engaging more in BHSA. Maybe, finding a way where there's a space so that those questions can be answered that we're starting to come up with. So just some ideas and insights.
Love the idea of TA, Corey. I don't know if there's any funding for that right now, but I think it's really important to think about how do we advocate. And I think CDA has done a great job of starting that with these county toolkits. I don't know, Sarah, if you have anything else to add around that. Hope you're on mute.
Sorry, I think that's absolutely right. We need to just keep raising awareness and, developing the partnerships and, all of that.
Great. All right, anybody else with brilliant ideas for how to serve older adults, connections, questions on BHSA?
This is Valerie again. I will just say one thing that's been a barrier with working with behavioral health and also with aging and adult service programs is confidentiality. It's been really difficult to develop like an MDT, even though APS and other programs might have, statutes that allow for sharing of information. It's really difficult to coordinate services when you can't really have everybody. I mean, not revealing everything, but what's appropriate that could be shared to for the continuity of services for people.
That's a really important point. Well, if there are no other questions or comments, Sharon, I'll turn it back over to you.
Hey, well, thank you. Thank you, Gretchen. Thank you, Heather. Thank you, Sarah. And thank you to everyone that participated today. We do have a survey in the chat. If you're able to add your information to that survey, we would greatly appreciate it. Our next Lunch and Learn, I'm not sure if Peter wants to give that information, but we'll give some information maybe in the chat about a little preview of the date for the next Lunch and Learn. And so please be on the lookout for that. If you also have any ideas, make sure you put those in the survey if there's something that you would like to know a little bit more about. So with that, I would like to say thank you for attending today and have a good rest of your day.
Great. Thank you so much.